How you doing? This is Dr. Dieguez, and today the video will be about what else would you do? What other tests would you order? So let's say you have a patient that has low oxygen levels, and they're coming to you for an explanation as to why his oxygen saturation is coming down to 84% on room air. Okay, so this patient is a smoker and never has been diagnosed with COPD. So a pulmonary function test will be a test to do to see if we have COPD. Let's say the patient has never been diagnosed with congestive heart failure, but is not having any orthopnea, is not having any leg edema, but still an echocardiogram will be a good test to do because it can give you that information, and it will also give you information as to whether or not they might have pulmonary hypertension. Okay, so then we do an x-ray or even a CAT scan of the chest to look at the lung parenchyma to see if the lungs have any type of fibrosis or scar tissue, if there's any pneumonia, if there's any fluid collections, so to see if there's any abnormality on the lung. So imaging studies will be indicated. Okay, so again, a patient, no history of any blood clots in the past, but you sometimes do a VQ scan to rule out any chronic thromboembolic problems. And if you did a CT scan of the chest with contrast, sometimes that information can also be on that CAT scan. But let's say that all of those things are normal. What else would you do? So sometimes you can order an ABG to check the actual level of your PaO2 and your PCO2 level, because some patients that are CO2 retainers might have a low oxygen level because of that. So, all right, we did an ABG and it did not show any PCO2 level elevation. So what will be the next step? So something to keep in mind sometimes are cardiac shunts. Sometimes you might have a communication from the right side of the heart to the left side, and that's allowing blood with no oxygen to go to the left side. And if that happens, a patient will have hypoxia, will be having a low oxygen. So a test to do will be a bubble study, echocardiogram study, and sometimes the cardiologist might do a transesophageal echocardiogram to look at that. So what else would you order if these tests are normal? What other tests would you keep in mind and order on a patient that is presenting with low oxygen? Have a good day.